because I was at the attachment conference yesterday and I was giving a workshop on attachment today, attachment is very much on my mind, and in thinking about why we run into problems helping our patients. I think it's very important that we begin to, well, we do two things. First, when you run into a problem and you've tried everything and the patient isn't getting better, how do you usually feel? Could you just, it's your time to speak. Give me some material to work with.
Rejected.
Rejected. Blocked. Failure, somebody said a failure.
Why you let them down, depressed.
Okay. Sounds very familiar. I've been there. I think we've all been there. Now you've had a lot of information that you've downloaded today. So I'm sorry I had to miss the earlier presentations because I always learn from every time I hear people present on this topic, and then when I'm on the program I try to pick up on the threads from earlier presenters, but that I do know Dr. Clark's talk because he presented before me yesterday. So let's see. I think it's so important because I'm a psychotherapist and a psychoanalyst. I was trained always to look at my own reactions and expectations of my patients. And when I was working at Rusk Institute and working as part of a team approach, one of the things that we did in the role of the psychologist on the team was help the other members of the team, the physiotherapists, the occupational therapists, the physicians, understand why the patient wasn't getting better. And they were doing everything that they possibly could. And so we tried to offer some information about that particular patient that would help them get unstuck in their work. So when you start to feel stuck, when you've tried everything, you feel rejected, depressed, as soon as you start to feel that, the first place to go is ask yourself, what is my agenda? Why is this so important to me? Okay? And one factor that can be contributing to that, if you do it's kind of you could even journal about this, is you begin to really tune into what is your motivation for treating people anyway. What was your background in your own family and your culture around helping people, and also around being helped. In the clinical workshop I gave this morning, we worked on both directions in first thinking back to our childhoods, first to remembering our own experiences of being in pain, and how were we helped, or what if we weren't helped, and how did we cope and how did we survive that? And often that can be a motivation for us to go into this helping field, whichever field it happens to be. And then another angle on the same issue is what were your early experiences in being a witness to people in pain? People in your immediate family, people in your culture, and it's very important to kind of check in with that and get to know how those experiences affected you. And if we were doing if we had the time to do an experiential process with you, I would lead you through that and see what you discover. And it's always an exciting process to do because I always learn something and people learn from one another, but we don't have time to do that. But that's what I want to offer you as the first thing to do when you start to feel stuck, rejected, powerless, what's wrong, maybe even start to blame the patient and use diagnostic labels about the patient. Do a little journaling. Think about your own history and motivations for going into this field, and what were your experiences of being helped as a child, and what were your experiences in your formative years of seeing other people in pain, and see what comes out of that. Now you look first inward at yourself and see what you discover, and then the next step would be to think comprehensively, which I'm sure you already do, but often we get so involved in the thing that we're doing that we don't look at the entire person. So try to find a way, depending on your discipline, try to find out information about that person's experience of being helped. Now, when Dr. Clark presents, he just seems to do that very naturally, and the other members of you just know how to do that because you're thinking psychologically already. But in case you get stuck, step back and try to ask the same questions or get the same kind of information about your patient. Start wondering what were their childhood and formative years like in the area of being helped. Not necessarily in pain, but maybe they were. It might have been emotional distress and trauma. And you start to hear, if you can find a way to ask those questions, you start to hear whether or not this person has had experiences of being helped or not, and particularly if you have a way of finding out whether or not they had emotional or physical abuse, their expectations of being taken care of by a healthcare professional, that's very important to tune into that, because there may be a lot of mistrust, and I've found in my experience that the patients who have been most traumatized often have a lot of difficulty trusting that they're going to be helped, and even though they want to be helped, they wouldn't show up to see you, the physicians, the physiotherapists, they wouldn't show up in my office if they didn't have some shred of hope. But they may actually come in and, in the early days of working with Dr. Sarno, we got the patients who had been through everything, every surgery, whatever, the hopeless cases. And then they had to see me or another member of the team. So imagine the challenge I had. Okay, they felt like a failure already. So some patients come in and say, well, Dr. So-and-so says this, and I don't know, what do you think? Okay, so right away, if you get that presentation at the outset, you start to wonder, where did this come from? What is it about that patient's experience that they're showing up challenging me already? And so that's one kind of very obvious and difficult presentation. And certainly in the early days, I felt like I had to defend or prove something to them. And these days, when someone comes in with that approach, having learned the hard way, I get interested, or I try to get them interested in, what is your idea, and what would it take for you to be convinced, and how can I help you find out whether or not this theory pertains to you, even though I know you want to or you wouldn't have shown up to see me. But trying to engage them rather than fight with them or feel that I have to prove that the theory is right. So that would be something that I would suggest that you keep in mind when someone comes in with that presentation. Another presentation that is fairly common is an anxious clinging attachment style, and you have to help me right away. What are you going to do? I've done everything already. I've done the journaling, I've done this, I've done that, and you can just feel in the room the desperation. And that can be kind of hard to manage. Have you experienced that? So with that kind of person, because I'm the therapist, I have maybe more of a license, so to speak, to explore their history, but I would get very interested in their attachment history and what experiences led them to feel such a sense of urgency. How long have they been living with that sense of urgency? What has happened to their ability to settle down and reflect, and maybe they did the journaling, but it didn't help them? Like, why? What was going on there? The journaling didn't help. Some people in this subgroup of patients that we see are used to just following all the rules, so they'll do the journaling, but they're not really, it's not stirring up emotions, or sometimes the emotions are too intense, but they're doing it by rote, and they're following all the rules, and it's not working. And so with the person who comes to you in that state, helping them settle down and gently and steadily help them be able to think about and get connected with their feelings, that like they bring in a journal entry and happily read it to you, but they're not connected at all. They could be reading about somebody else. So how do you help them get connected with what they are feeling, or they are not aware of feeling? How do you gently do that? Okay, so that's one of the things that can happen with people who are, have a background where they learned to be people pleasers and perfectionists, and they would obey all the rules. They never developed a sense of their own authority. So they'll try to do everything you tell them to do, but it's not working. And that can be pretty challenging, because there they are saying they've done all the work, and what am I supposed to do? So with someone with that kind of presentation, it's a settling down and helping them begin to reflect on their own. Yes?
So would this be that the person's going through the motions of doing it, but they're not really putting the emotion into it, they're not putting their commitment?
They may be committed, but they don't know how to do anything but just rote. They're often either afraid or have never felt any feeling, but they're trying to. They're going through the motions. I've rarely had the experience that somebody's going through the motions and they really don't want to get better. I mean, occasionally, but helping them test and see right there in the room with me. If you tell me this thing, along the example that Dr. Clark just gave about how would you feel if your child or your partner or your sibling or your best friend had gone through this and they told you? You try to get their empathy and their emotions stirred up around somebody other than themselves. And I used that. In one of the cases I presented yesterday. Not a case. He's not a case. He's a person. It was. I happened to in the flow of the session, where he was still defending his abusive father, whom he loved and who was also good to him, which makes it more complicated. I asked him how he would feel if his 11-year-old son, whom he dearly loved, whom he had described in the same terms he described himself as sensitive, I asked him, how would your son feel if you beat him with the belt the way your father beat you? He started to cry. It started to open the floodgates for him. So just trying to help somebody, slow them down, help them be less frantic, that is what I would suggest that you consider doing with that second group of people. Now, there's another group, which I think is probably the most challenging. But an attachment point of view I've found helpful. This is the patient who may have been suffering for some time, a year or two, maybe more than that. They've gone to every PPD, TMS doctor in the United States, in Europe. They've seen all the therapists who have expertise in this. And so here I am. Have you encountered people who do this? Okay. How do you feel?
I feel one very strong thing that if, say your mother has abused you, let's say, not sexually, but whatever, you stand up for her and you stand up for her and you will not let that down until you get later on in life and then you admit it. I know this in many, many cases. They defend the person that's abused them. Do you have the answers to that? What you do with that?
Well, I'd like to tie that into the answer to this question.
Okay.
But if you could just, have you had the experience of someone?
Yes.
Okay, and it
was me.
Okay, so was it hard for you to trust the authority figures that you went to, even though you wanted to?
Well, no, I just stood up for my mother completely and utterly. She was the most wonderful person on earth. I wouldn't let anyone
Oh, you
touch
defended her. You
Defended.
Yeah, like my patient that I
Yes,
just
yes,
mentioned,
exactly.
Martin, my patient. Okay. So, did you find that affected who you could trust when you were looking for a diagnosis?
No, but I couldn't clear my pain up until I cleared that up.
Right. Exactly.
It's impossible.
Okay.
'Cause I hadn't got rid of the poison.
Right, exactly. So I'm not going to ask you more questions now because it's very personal, but thank you for sharing that, because therein lies one of the problems.
And it is a huge problem.
It's a huge
and
problem.
I confided in one sister. I have three, but I confided in one.
Mm-hmm.
But for her, I would not be up and running. I would still be in the chair.
Mm-hmm. Well, I'm glad you persisted and you found
Yeah.
somebody to trust.
Oh, the
Yeah,
sister.
yeah. So let me just say a few more words about this. Have any of you had this experience? The person who's gone through everybody and
seen every specialist.
Yeah. So what do you usually do?
Well, as a therapist, you feel already like disempowered. They're almost limiting your chances by this very atmosphere they're created.
And
I feel like the savior, so I'm
the one. Exactly. I've been there often. Like,
You're feeling
I can do it.
No, when you're faced with that situation, you feel incompetent. Everybody else has tried, they failed. Why should you be able to succeed?
Well, that's a different response to the same situation. you know? And I've had both. Sometimes I've felt like, oh no, I can't do this. What am I going to do? I'm supposed to be an expert. I don't know. Yes, David.
I think it's part of their power game. It gives them power to shut you down too. So they're angry, it's just part of their power game. So it gives them, so when you become attached to their outcome, you're playing right into their hands.
So you're suggesting to try not to become attached to the outcome for that person.
Let's change my practice dramatically. So I went to David Byrne's course about 3 years ago. He talked about open hands. It just said, look here, I'm here to help you out, and come back anytime if you're not ready for it. And so that's completely changed my practice. And it takes away their weapon. They can't come at me anymore.
Well, that's great. Why do you think they have the weapon? What do you think has gone on in your experience with people who present that way? How do you think they got to need that as a weapon?
I mean, I think they're incredibly angry. And I think anger is very destructive. And I'm just one of their destructive parties.
Certainly, do you resonate with them? We've all worked with people where that's a mechanism they have for trying to feel empowered.
Yeah, or self-preservation as a protective factor is developed for that reason. So in order to kind of work with somebody like that, if you take that away, then what's keeping them safe and trusted?
Right. So being mindful and attuned to that as a possible protection and not getting caught into it. And you found your way not to get caught in it. We may find other, each of us, depending on our history and our philosophy, the goal would be to try not to get caught into that and try to find a way to understand and, engage the patient if you can in, what they might be looking for, who do they think could help them, why do you think, you can open up a whole conversation if you don't get defensive. You can say, so what do you think happened that you haven't been helped yet? Help me understand it. Can we think it through together? Yes.
I found it very helpful to just move back that I'm feeling intimidated from the start, to acknowledge that feeling and to say, let's try and figure out why it hasn't helped in the past and maybe what I can do. But to acknowledge that is there and get it out of the way. So it doesn't manifest itself on my end as maybe distancing or anger or frustration. And it's been received very well, and I've been honest just to say, well, that put a lot on me. I feel kind of intimidated, but I am here and I am going to try and help you as much as I can.
Okay. So that works for you. I saw some other people nodding that can work. Yeah.
I'm not a practitioner, but I have a friend who has a lifetime gastrointestinal problems, and he's been to every imaginable mainstream specialist and many alternative and complementary practitioners, and he's still always on different diets. When in late middle life I encountered TMS PPD personally via chronic back pain and was effectively successfully cured by those processes, I made a point of telling him all about this without actually suggesting to him that he might have a similar condition. And he brilliantly passed this information on to colleagues with back pain, who then cured their own back pain. At a later date, he even told me with some interest that he was reading a book by a French specialist. He's a very brilliant man, this person. Professor of English and a poet. You name it. Writing a book on poetry and science. He's a clever man, he's an intellect. But he told me with some sort of fervour about a book he was reading by a French specialist titled, "It's Not What You're Eating, It's What's Eating You." And still, he is in a state now, as I say, I'm not a practitioner, but I am a concerned friend. And I have the sense that he is so identified with his illness is him, he is his illness. And he is now at my age, he's in his mid-60s. And I feel that the problem for any therapist would be to disentangle him from his condition.
I understand.
I'm just describing that.
Yes, no, this is a very good, thank you.
You're evoking.
Yes, thank you for talking about this, because, and Peter's going to be, how much time do I have? Oh, I have 10 minutes, okay. And I just can tell Peter's going to pick up on some of this theme later. But see, I don't think, when I see somebody, I don't think of it as my job of untangling them from there. I want to help them because I can see their suffering. What I try to do is engage them in a curious exploration of all their experiences of being helped and not, and try to find my way back to the earliest, the most formative. Okay, someone who presents in this way, it's very likely that their early attachment history was one in which they couldn't trust anybody, and they just became very self-reliant, and nobody can tell me, but it kind of goes underground and gets turned around. They keep seeking, but they have to have the final word, and nothing is going to help me. And I, respecting that is a kind of adaptation to some kind of life history. So I try to get curious. I try to get people curious about their experience, and that can help me get out of the tangle on the power game, the power struggle. Yes?
And have you got an example of how that then helps and what you see in your patients? Is that curiosity, they internalise that, and in that exploration does it start to shift?
Okay, I'll just give you, and I'll just take this as my kind of ending vignette. This is someone I saw a few years ago. Very intelligent, accomplished woman. And there's heavy disguise here, so you would never recognize her, the person. So very accomplished, back pain on and off for episodic for about 10 years, in her late 30s. She was something, she was a person who's well known, so she could and did go to every doctor, every therapist who had written anything about TMS. And after an exhaustive process, she picked me. And I had a little bit of that feeling like, oh, I can be the one. I know. I thought, this is very dangerous. I know that any minute, any day, she can leave because she's found somebody else. So I had to work really hard to sit with myself, and when she would mention somebody else's name or yet another doctor, I would say things like, questions sort of like, so, the important thing here is that you learn to trust your own judgment. So I'm here to help you talk about whoever you want to see, why you want to see them, how you think that will help, if you think our talking about that will help. But I will not see you in therapy if you're seeing another psychotherapist, okay? Now, there are people who won't tell you that they're seeing another therapist. Okay, so a lot of painstaking. This woman still went on to see other doctors, had other therapists, I discovered. So we had a period where I went along with that, and then I asked to coordinate with that therapist, got permission, and we had a very productive discussion, and that therapist decided that she was going to say, you know, I think it's time that you try just this one point of view, because the therapist did agree with the point of view, the PPD point of view. So then we settled into a period of really working on where this came from in her experience. And she was psychologically sophisticated, so she knew all of this. It wasn't a return of repressed memories. It was her not recognizing the stress of growing up in her family. Father alcoholic and violent, mother many illnesses, traveled a lot, was rarely home, parents divorced, 2 older siblings who kind of helped raise her, but would send her out to do their dirty deeds, you know, and they would tease her and mock her. And what we began to discover and together was she grew up without anyone to trust. And kind of because she was scrappy and very intelligent, she was able to find a way to become quite successful, but so anxious and so uncertain about, I mean, it was like, who is right? Who can I go to for the answer? And as we worked together, she began, and I kept supporting, okay, so what do you think you need to trust your own judgment? A lot of rumination about past decisions. Did I make the right decision about that? And it's still she made a lot of headway, but she did leave treatment with me. Better, not completely pain-free, but it was a situation in which what I was able to offer her was to help her to understand that she was looking for the answer out there, and the answer really was inside, and to support her in being able to make up her own mind. And I didn't, but it was hard. So it's this. I'm going to end with that vignette. So any 5 minutes? 2 minutes? Okay. So time for one burning question. We have 2 minutes. No burning questions.
How important is it to get the right therapist who has the chemistry, the right and correct chemistry for you to get the stuff out?
I believe it's very important. And I speak from personal experience,
Because you can't talk to some people.
You can't. So I tell patients right at the beginning, look,
It has to be right.
the most important thing is that you sense that we have a connection that you can trust and feel safe. And it may take you a few sessions to know that. And I also say, if I feel like I'm not the one who can help you for whatever reason, I'll tell you. So that's the deal we make.
That's good.
Thank you very much.
Thank you.